Good morning, everyone. We are the Group 2 and we are tasked to discuss the radiation protection procedures in nuclear medicine. So here's Mr. Evangelista for an overview of our discussion.
Good day, I am Ezekiel Montecalvo Evangelista and I am here to discuss about the overview of nuclear medicine. So first, what is nuclear medicine? So a nuclear medicine, it is a vital component of rapidly emerging field of molecular imaging. It is an medical specialty na gumagamit ng maliit na amount ng radioactive material with its radiopharmaceuticals in combination with imaging instrument that examine molecular processes in our body para ma-evaluate ang isang disease like brain disorders, heart disease, and cancer. In addition, radiopharmaceuticals ay ginagamit sa therapy in the treatment like overactive thyroid and some cancers. Nuclear medicine can be used to determine whether or not organs are functioning normally. So, ang nuclear medicine daw ay pwedeng gamitin upang malaman kung ang mga organs sa ating katawan ay nagpa-function pa ba ng normal. It show whether the blood supply to the heart is adequate. At ang nuclear medicine din ay maaaring gamitin upang makita kung ang blood supply sa ating puso ay sapat pa. And detect cancers at an early stage. It determine the extent of cancer and assess the response of cancer to treatment. Nuclear medicine can be used to discover whether the heart can pump blood adequately. So, ang nuclear medicine din ay maaaring gamitin upang malaman kung ang ating puso ay nagpapump pa ba ng blood ng sapat. And it identify abnormal brain lesion without any exploratory surgery. And nuclear medicine can be used to detect the brain if receiving an adequate blood supply and if brain cells are functioning or not. So, nakatulong din ito or ginagamit din ang nuclear medicine upang malaman kung ang brain natin ay naka-receive pa ba ng sapat na blood supply. And kung ang ating brain cells ay nagpa-function pa ba. And nuclear medicine can be used to check whether or not kidneys are functioning normally and whether the stomach is emptying properly. And a certain lung function in bone density and it locate a bone fracture before it can be seen on an X-ray.
How is nuclear medicine administered? Nuclear medicine is a specialized area of radiology that uses very small amounts of radioactive materials or radiopharmaceuticals to examine organ function and structure. Nuclear medicine imaging is a combination of many different disciplines. These include chemistry, physics, computer technology, and medicine. This branch of radiology is often used to help diagnose and treat abnormalities very early in the progression of a disease, such as thyroid cancer. Because X-rays pass through soft tissue such as intestines, muscles, and blood vessels, these tissues are difficult to visualize on a standard X-ray unless a contrast agent is used. This allows the tissue to be seen more clearly. Nuclear imaging enables visualization of organ and tissue structure as well as function. The extent to which a radiopharmaceutical is absorbed or taken up by a particular organ or tissue may indicate the level of function of the organ or tissue being studied. Thus, diagnostic X-rays are used primarily to study anatomy. Nuclear imaging is used to study organ and tissue function. So, a tiny amount of radioactive substance or material is used during the procedure to assess in the exam. The radioactive substance called a radionuclide or radiopharmaceutical or radioactive tracer is absorbed by body tissue. Several different types of radionuclides are available. This includes forms of the elements technetium, thallium, gallium, iodine, and xenon. The type of radionuclide used will depend on the type of study and the body part being studied. So after the radionuclide has been given and has collected in the body tissue under study, radiation will be given off. This radiation is detected by a radiation detector. The most common type of detector is the gamma camera. Digital signals are produced and stored by computer when the gamma camera detects the radiation. By measuring the behavior of the radionuclide in the body during a nuclear scan, the healthcare provider can assess and diagnose various conditions such as tumors, infections, hematomas, organ enlargement, or cysts. A nuclear scan may also be used to assess organ function and blood circulation. The areas where the radionuclide collects in greater amounts are called hot spots, or the areas that do not absorb the radionuclide and appear less bright on the scan image are referred to as cold spots. So in planar imaging, the gamma camera remains stationary. So therefore, the resulting images are two-dimensional. Single photon emission computed tomography or SPECT produces eggshell slices of the organ in question because the gamma camera rotates around the patient. These slices are similar to those performed by a CT scan. In a certain instances, such as PET scans, three-dimensional images can be performed during SPECT data. So basically, nuclear medicine can show how the organs or tissues are functioning. For most diagnostic procedures, a tracer which contains radioactive material is injected, swallowed, or inhaled. Then, the healthcare provider or radiologist, a healthcare professional with special training to use radiation in healthcare, uses a radiation detector to see how much of the tracer is absorbed or how it reacts in the organ or tissue. This gives the provider information about how well it is functioning.
How is radiation used in nuclear medicine? In a nuclear medicine diagnostic procedure, a small amount of radiopharmaceuticals are introduced into the body by injection, swallowing, or inhalation. The amount of the radiopharmaceutical that is used is chosen to provide the lowest radiation exposure to a patient while ensuring an accurate medical evaluation. These radiopharmaceuticals are designed to go to the specific organs, for example, the liver or the heart. Detect and treat diseases by using small amount of radioactive material called radiopharmaceutical. Radiopharmaceuticals are agents used to diagnose certain medical problems or treat certain diseases. A special radiation detector like scintillation camera is used to obtain images of the distribution of the radiopharmaceutical in the body. The positron emission tomography scans provide a means to study many types of disease in the body by determining how a disease uses radioactively labeled sugar, thus using the body's own processes to determine disease status. Radiopharmaceutical are radioactive agents. When radiopharmaceuticals are used to help diagnose medical problems, only small amounts are given to the patient. The information that follows applies only to the radiopharmaceuticals when used in small amount to diagnose medical problems. The radiopharmaceutical then passes through or is to taken up by an organ of the body. Which organ depends on what radiopharmaceutical is used and how it has been given. The radioactivity is detected and pictures are produced by special imaging equipment. These pictures allow the nuclear medicine doctor to study how the organ is working and to detect cancer or tumors that may be present on the organ. A positron emission tomography scan is an example of a nuclear medicine procedure used to diagnose disease. A positron emission tomography scan uses a radioactive substance that is inserted into the bloodstream and travels to a specific organ. Doctors use a special camera to watch how the tracer moves.
What levels of radiation are involved with diagnostic nuclear medicine procedure? The amount of radioactivity administered to the patient are relatively small and are designed to provide the highest quality diagnostic information possible while minimizing the radiation dose to internal organs. The radiation dose to different patient and internal organs varies with the procedure. A typical nuclear medicine procedure may impart a radiation dose to patient comparable to about 1 to 4 years of natural background of radiation, depending on the type of the study. As with X-rays, the value of diagnostic imaging is great and the risks are negligible compared to the health benefits of having the procedure. Imaging and treatment procedure use a very small amount of radioactive materials called radiopharmaceuticals. During the imaging procedure, we captured precise images of a specific area inside the patient body. A very low rate of radioactive materials is given to the patient as food, drink, intravenously or by inhalation by injecting into under the skin. This radioactive material which is given goes to the targeted organ or tissue and shows uptake there. The radiation received by the patient during this procedure is at a very low level considering the benefit of Low's balance. Average effective dose for most nuclear medicine procedure varies between 0.3 and 20 millisievert. These doses can be compared with the average annual effective dose from the background radiation of about 3 millisievert.
How do nuclear medicine procedures compare with X-rays and CT scans? So, nuclear medicine scans detect the radiation coming from a radiopharmaceutical that is inside a patient's body. In contrast, other imaging procedures, for example X-ray and CT scan, obtain image by using machines that send radiation through the body. Nuclear medicine is also different from other imaging procedures in that it determines the presence of disease based on biological change in tissue rather than change in anatomy. Nuclear medicine procedures are among the safest diagnostic imaging exam available. The amount of radiation received from a nuclear medicine scan is comparable to that of many diagnostic X-ray and CT procedures. One of the most commonly used nuclear medicine exam, that PET scan, is often performed in conjunction with computed tomography CT scan because the combined image provide precision with both functional and anatomical information of the body.
Radiation safety standards in nuclear medicine. In the modern diagnostic and therapeutic nuclear medicine, radiopharmaceuticals are successfully used for the diagnosis and increasingly for the treatment of diseases. Despite the increasing benefit for patients from the nuclear medicine technologies, their use poses a radiation health risk for those who are exposed, especially when the radiation protection guidance and principles are not properly implemented. The three different types of exposure can occur in nuclear medicine. First, the medical. Medical exposure is confined to exposures incurred by individuals as part of their own medical diagnosis or treatment. This medical incurred knowingly and willingly by individuals in the support and comfort of patients undergoing diagnostic or therapeutic procedures for which They are referred to diagnose or treat diseases such as cancer, cardiovascular diseases, and many others. The second exposure is the occupational exposure, refers to workers being exposed to ionizing due to procedures within their workplace, radiation workers including workers in the medical field. And the third exposure, the public exposure, incurred by members of the public due to source in planned exposure situations, emergency exposure situations, and existing exposure situations, excluding any occupational exposure or medical exposure. The goal of radiation protection in nuclear medicine is to ensure that the expected medical outcome for the patient is achieved and the procedure optimized while limiting the radiation risk to the patients, medical personnel, and public. The Nuclear Regulatory Commission regulates the use of radioactive material, including radiopharmaceuticals. The NRC requires all nuclear medicine facilities to be licensed. Facilities must prove they have a radiation safety program to protect both the patients and the staff in order to get an NRC license. In addition, the staff must meet certain standards of training and experience before they can treat patients with radioactive material.
Hello, I am your next reporter, April May Cuacho. Occupational exposure. Workers shall A. Follow any applicable rules and procedure for protection and safety specified by the employer, registrant, or licensee. Follow, it means that following rules is important to make sure that the procedures being done are proper and according to what is written or should be applied. Also, following the rules and procedures will ensure that the patient will receive a proper treatment. Letter B. Use properly the monitoring devices and the protective equipment and clothing provided. Means that using the devices and protective equipment and other materials properly is part of the responsibility workers should be doing and taking note of. That every time that a procedure is done, all of the devices, equipment, and clothing should be properly put back on its places to make sure and to avoid na masisira, mawawala, or misplace ang mga gamit or materials or devices, clothing, and equipment. Letter C. Cooperate with the employer, registrant, or licensee with respect to protection and safety and the operation of radiological health surveillance and those assessment programs. A peaceful workplace is a good place. Respecting and cooperating with the employer in terms of protection and safety and procedure will bring great achievement as a radiographer, employee, and also para sa patient knowing na the radiographer knows everything kung paano mag-ihimo ang procedure. Letter D. Provide to the employer, registrant, or licensee such information on their past and current work as is relevant to ensure effective and comprehensive protection and safety for themselves and others. Providing information of your past experience can be a big help to determine to know kung alam mo ang isang procedure, kung tama ba yung pag-assist sa patient with care. Also, it will provide basic knowledge that you can ensure an effective and the procedure you will be making is safe para sa patient, workplace, and para sa mga katrabaho na to make sure na waray mapapahamak during and after examination. Letter E. Abstain from any willful action that could put themselves or others in situations that contravene the requirements of the standards. It means na Di ka maghihiyo mga bagay or action na makakapahamak sa ibang nga tao na makalabag sa protocol, rules, and law, and pasok sa standard sa paghihiyo sa procedure or examination. Letter F. Accept such information, instruction, and training concerning protection and safety, as well as will enable them to conduct their work in accordance with the requirements of the standards. Information that will be a great help and appropriate legal training about the protection and safety from using radiation. Ini siya is makakatulong para sa mas maayos nimo na pagtrabaho and pasok sa requirements of the standards. Next part of the report is medical exposure. With regard to responsibilities for medical exposure, requires that registrants and licenses shall ensure that a. No patient be administered a diagnostic medical exposure unless the exposure is prescribed by a medical practitioner. We know that we are not allowed to proceed an examination or procedure without doctor's order. Doctor's order will determine what kind of procedure should be done for the patient. And also, nasa protocol and law na dikit pwede mag-proceed sa sayo nga procedure or kapag waray doctor's order. Letter B. Medical practitioner be assigned the primary task and obligation of ensuring overall patient protection and safety in the prescription of delivery of medical exposure. The patient's safety is the top priority to make that the patient should not receive an exceeding amount of radiation na dapat niya ma-receive sa sayo nga procedure. And tama and exact procedure ang himuon sa tama nga pasyente. Letter C. Medical and paramedical personnel be available as needed and either be health professionals or have appropriate training tasks in the conduct of the diagnostic or therapeutic procedures that the medical practitioner prescribes. It means that all appropriate medical professionals ang dapat mag-proceed sa procedure, mag-assist sa patient, and dapat nakaka-receive tama na training ito ng mga RadTech to make sure na tama sa amounts ng KVP, MAS ang ma-receive sa pasyente. Letter D. The exposure of individuals incurred knowingly while voluntarily helping other than in their occupation, in the care, support, or comfort of patients undergoing medical diagnosis or treatment be constrained as specified. It means that medical exposures are predominantly delivered to individuals, especially to the patients, undergoing diagnostic examinations, interventional procedures, or radiation therapy. Other individuals caring for and comforting patients are also exposed to radiation. These individuals include parents and others, or normally family or close friends who hold the children or person with disabilities during diagnostic procedures or may come close to patients following the administration of radiopharmaceuticals. Exposure to members of the general public from released patients also occurs, but this exposure is almost very small. That is why we need to make sure that the amount the patient should receive should never exceed to be safe from radiation. Letter E. Training criteria be specified or be subject to approval as appropriate by the regulatory body in consultation with relevant professional bodies. The training of the medical professionals should be approved by regulatory professionals. which is the people that evaluate kung tama ang procedure and kung tama ang imo paghimo ngan diri makapahamak sa ibang nga tao or sa pasyente. Last part of my report. Public exposure. Registrants and licenses shall apply the requirements of the standard as specified by regulatory body to any public exposure delivered by a practice or source for which they are responsible. If the registrant or licenses is therefore responsible for controlling public exposure resulting from a nuclear medicine practice. The presence of members of the public in and near the radiology department shall be considered when designing the shielding and flow of persons in the department. To comply with the requirements, registrants and licenses should A. Develop and implement use, storage, and transport measures for ensuring the safety and security of radiopharmaceuticals to control public exposures in accordance with the requirements of the regulatory body. It means na ang mga radiopharmaceuticals is nakastore sa tamang nga storage and making sure that the only people who have access are authorized people to avoid contamination and safety sa public. And making sure na dili ma-expose ang mga tao para makaiwas sa mga possible na sakit pag nagkayaon sila contact sana without knowing kung paano ang tama nga pag-handle. Letter B. Control and maintain constant surveillance of licensed material that is not in the storage. For example, when nuclear medicine sources are being transported or used for treatment. And secure stored licensed material from unauthorized access, removal or use. For example, the storage facility shall be locked at all times. While transporting all the materials for use, dapat maingat and nasa secure na storage ang materials to avoid contamination and mali na paghawak sa naang material. Also, authorized people are only the people allowed to handle the material, habang ang materials na dili kagamiton is nasa secured storage and unauthorized access should be avoided and prohibited to make sure that the room where the materials are secured, safe, and to make sure that none of the materials will be missing. Letter C. Registrants and licenses are responsible for ensuring that the optimization process for measures to control the discharge of radioactive substances from a source to the environment is subject to those constraints established or approved by the regulatory body. Process optimization main goal is to reduce or eliminate time and resource wastage, unnecessary cost, bottlenecks, and mistakes while achieving the process objective. We only spend time correcting an error if the mistake exists. It is not enough to know that, but to know how to accomplish that. Dapat tama ang procedure para makaiwas magulit-ulit sa procedure. Also, next is to make sure that the dosage is right and wouldn't cause any accident. While doing so, makaka-ensure na ang procedure na atong ginihimo is following the regulation standard. Well, that is all. That is all part of my report. Thank you.
This is the Table 1 Summary of Radiation Protection Principles as applied to occupational and public exposures. In this table, we have two types of applications. The applications in general and applications to medical exposure. In applications in general, we have justification of practices, limitation of doses, and optimization of protection.
Justification of practices. The application to medical exposure is by weighing the diagnostic or therapeutic benefits produced by exposures against the radiation detriment they might cause, taking into account the benefits and the risk of available alternative techniques that do not involve the medical exposure. A limitation of doses is not applicable to medical exposure. Optimization of protection is the optimization of protection. The applications to medical exposure is in the diagnostic medical exposure, keeping the exposure of patients to minimum necessary to achieve the required diagnostic objective, and therapeutic medical exposure, keeping the exposure of normal tissue as low as reasonably achievable, consistent with the delivering the required dose to planned target volume. The Table 1 is the safety standard established that the safety culture should be fostered and maintained to encourage a questioning and learning attitude to protection and safety, and to discourage complacency. To comply with this requirement, hospital managements needs to be committed to an effective protection and safety policy, particularly at the senior level, and by demonstrable support for those persons with responsibility for radiation protection. The commitment can be demonstrated by a written policy with, in addition to recognizing the objective of the practice is the diagnosis, treatment, and well-being of the patients, assigned the required importance, protection, and safety in nuclear medicine. An ambitious statement should be made known to be hospital personnel and implemented by establishing quality assurance program that provides for compliance with the radiation protection requirements and fosters culture in the hospital. Next is the Table 2 Summary of Individual Dose Limits. In this table, we have dose category, occupational exposure, apprentices of 16 to 18 years of age who are in training for employment, and students of 16 to 18 years, and then the public exposure. And then dose category, we have the effective dose, equivalent dose to the lens of the eye, and equivalent dose to the extremities or hands and feet or the skin. And in effective dose, the occupational exposure is 20 millisieverts, average over 5 consecutive years, 50 millisieverts in a single year. And in the apprentices is 6 millisieverts, and the public exposure is 1 millisieverts. In special circumstances, and effective dose of up to 5 millisieverts in a single year, provided that the average dose over 5 consecutive years does not exceed 1 millisieverts. And then next is the equivalent dose to the lens of the eye. The occupational exposure is 150 millisieverts, and the apprentices of 16 to 18 years is 50 millisieverts, and the public exposure is 15 millisieverts. Next is the equivalent dose to the extremities or hands and feet or the skin. The occupational exposure is 500 millisieverts, and apprentices 150 millisieverts, and public exposure is equivalent dose to the skin of 50 millisieverts. And that's all the Table 2 and the report of Group 2. Thank you.